Peripheral arterial disease, a common medical problem that causes loss of limb, ulcers, wounds, difficulty walking. It commonly affects individuals with diabetes, vascular disease, and other chronic illnesses. We're going to deal with such a patient that had severe peripheral artery disease to the point that he required walking on crutches. Welcome back to Montgomery Heart and Wellness, and we have another case of clinical rounds. Camille is back with us this week, and who are we talking about? This patient, 75-year-old man with peripheral arterial disease, right?
Yes, so he came to Houston from out of state because he had severe peripheral artery disease, lots of plaque buildup in the arteries of the legs, and he'd been suffering with this for years, and it had been so bad at one point he had big ulcers on the legs and feet. So when he came to us, he was on crutches, lots of pain, discoloration, tingling, and numbness in the legs.
So this was one of his main chief complaints,
Right.
was the peripheral arterial disease, among other things, which we dealt with, of course,
Yeah.
as you pointed out. Wow. So quite a complex patient. So in walking in crutches, lots of pain. Oftentimes we deal with patients with pain. We're not sure the source. Sometimes it could be due to nerves or circulation or a combination. Oftentimes nerve pain could be due to poor microcirculation to the nerves.
Right.
So his medical history, what was that?
So he also had extensive coronary artery disease, and he had had a stent to the left anterior descending artery in 2014. He also had a history of congestive heart failure. His ejection fraction was normal and improved when we saw him initially. He had type 2 diabetes, he had high cholesterol, hypertension, and restless leg syndrome that was really bad.
Wow, quite a bit going on. Okay, so what was our therapeutic approach?
So we put him on a raw detox with intermittent fast, and the diet's the most important because it gives you vitamins and minerals that act as antioxidants to combat the damage caused by free radicals. And when you go plant-based, you can easily lower your cholesterol, your vascular inflammatory markers, improve how those blood vessels open up.
And you mentioned free radicals. I'm just going to throw something here real quick. Inflammation is one. Increased oxidative stress, that's because of the free radicals you mentioned. And what people may not understand is that raw plant foods, they reduce inflammation and they do it rapidly. Probably better than steroids, that's one. And two, these free radicals are like unstable molecules. And plant foods, the green plants, act like antioxidants. They like donate an electron, they stabilize these free radicals so they don't fly around doing damage. And so that's a good point.
Yes, and he did the infrared sauna and the beamer therapy. Those therapies are really great for peripheral vascular disease, and infrared sauna in studies has been shown to improve scores on diagnostic testing we'll talk about, improve patients' exercise abilities or how long they can walk until they have to stop because of leg pain. We also did some IV therapies that I think really helped him. One was IV Plaque-X.
Okay.
Plaque-X is a molecule called phosphatidylcholine that stabilizes cell membranes. So it helps increase antioxidants like glutathione. It activates an enzyme called LCAT that helps the good cholesterol do a better job to pull the bad fats and cholesterol out of the arteries. So it works in a lot of ways to really stabilize the lining of the blood vessels. And he did about 10 of those, 10 treatments. The good thing about Plaque-X, it's also been shown to help liver and kidney function, and in a lot of our patients, these risk factors like high cholesterol, diabetes can cause, in and of themselves, liver and kidney
problems.
dysfunction.
That's right.
So chelation's another type of IV infusion of an amino acid called EDTA mixed with other vitamins and minerals. That really helps to pull out calcified plaques, and it does so by removing excess calcium or toxic heavy metals from the body.
We evaluate the extent of circulation problems. We do
Right.
Doppler studies. We do what's called ABI studies. So what was our before and after?
So on the Doppler, which is an ultrasound of the arteries in the legs, the left leg, one artery called the popliteal artery, the amount of blockage initially was 45%, and it went down to 20%. And that was from October to December. So that's a very large drop in a short period of time. And then in the right leg, what we call the anterior tibial artery, that had a severe blockage of 70% in October, and that went down to 65%, so a little bit, but it technically went out of the more critical zone. And then we also looked at the ankle brachial index. So that is a test where we compare the systolic pressure in the ankles to the arm to give an idea of blood flow or perfusion to the legs. So a good score is above 0.9 to 1 or maybe 1.2. So initially he had really low scores. On the right leg, the ABI score was 0.68 in November, and then in December it went up to 0.73. So that improved, and then in the left leg, that was actually worse. In the left leg, the ABI was 0.47, so that's a lot more critical. And that pretty much doubled and went up to 0.96. And, clinically, he was having way less pain, and the legs and the hyperemia or the discoloration looked better on repeat assessment. And we also checked the arteries in the neck because we know if somebody has buildup in arteries in one part of their body, it's likely diffuse and widespread. So on the left internal carotid artery in the neck, that initial blockage or stenosis was 25% in October and went down to 10% in December.
Very significant change.
So he initially was on 7 medications and went down to 5 medications. But with some of those medications, like for the restless leg syndrome, we were able to really reduce the dose a lot. And that really improved his quality of life because that would really keep him up at night a lot.
Yes. And also we have more work to do. So
Yeah.
as he continues to improve, the dosage may go down and he may come off those other medications as well. So in summary of the progress.
So summary, add reduced narrowing of the blood vessels, reduced buildup in the blood vessels in the legs and the carotid artery, all while being on less medications. And the inflammation also went down. And that's how everything really improved. And his quality of life was better. So, that's also one of the most important things.
Yeah, impressive. And also he was able, we didn't mention it here, it wasn't part of the emphasis of today, but I think we were able to get him off insulin and keep him off insulin, which I think also helped. But again, it's the therapy we use is global, and it has, an effect on all aspects of the person's well-being. And so quite impressive. So any last comments for our audience?
I think this highlights how quickly you can actually take steps to reverse severe disease, because the medications don't reverse a blockage from 25 to 10% in that period of time.
Yep.
Only lifestyle changes can do that.
There you go. Well, I hope you enjoyed this. As always, I learned something, and this is a pretty impressive patient. If you have any questions or comments, please leave them in the comment section of the channel, and one of our team members will try to respond to that. Until next time, take care. Thanks for watching. If you got value out of this video, please like it, subscribe, and hit the notification button to see our next show.